All right, so we're going to go ahead and get started now. I'm going to be helping to let people in too. So my name is Lisa Terry. I am an early intervention professional development consultant here in Virginia. So I do a lot of the professional training for early interventionists in our state. Also, I am endorsed as an infant mental health, infant family specialist in infant mental health through Virginia's endorsement process. And I'm also an RP ambassador. So if you have any RP ambassadors, hi everyone, and welcome. We're just glad that you are joining us. So I'm going to go ahead and pass it on to Elvia and let her introduce herself.
Hello, everyone. My name is Dr. Elvia Cortez. I am in California. It is such a pleasure to be here with all of you and hope that this is a meaningful conversation for you to just dive into the concept of infant mental health. I have an endorsement in California as a practitioner in infant mental health, and also a mentorship in reflective practice, which is one of our highest mentorship endorsement. And I am the program director of an infant program that covers 6 counties here in our state. And I am a professor also at a community college, helping the new generation and coming into the early intervention. Welcome, everyone.
I always just think every time you say it, I'm like, oh, she's just a busy woman. Well, we're excited to have you join us. Let's go over our objectives today and what we're going to cover. We're really going to talk about the infant mental health competencies and really talk about some of the strategies. We'll be very specific in some of the strategies and really think about how we can implement that into practice, because I always think that's the most important thing. We're actually going to do that and illustrate some of that through a video that's a case study today where somebody is sharing their story and their perspective, a parent, and we'll really dig a little bit deep into that. But we also do want to give a little bit of a background for those that might not all know a little bit more about the infant mental health endorsement. We have found that a lot of people actually are unfamiliar with it still, especially a lot of practitioners in the field. I don't know, how's our poll, Elvia? You can see our poll. I can't see it since I'm in Zoom, but what's our poll percentages looking like?
Let me see.
You guys see, there's a poll in Whova that's asked if you have the endorsement in infant mental health or not.
It's 10% have the endorsement.
Okay, so 10%. So that's a good, that's about right. That sounds about right. And so I know that usually people are always asking me like, well, what is the infant mental health endorsement, or how do I get it, or what's available in my state? And so we'll touch base on that. We do want to draw attention to the DEC Recommended Practices, because really by implementing the infant mental health competencies, practitioners are really nurturing those relationships between the parent and the child by building on their strengths, by identifying areas to support the emotional well-being of each individual family. And I think that's really important too when we think about each individual family, because each family has their own story. Each parent individually has their own story, each child has their own story, and then the family itself as a whole, they also have their own story. And so it's really important to just kind of hold that in mind when we are doing this work with families. So the 2 DEC recommended practices that we just thought that we would really highlight that align really well with the infant mental health competencies. The first one is the family, number 5, practitioners support family functioning, promote family confidence and competence, and strengthen family relationships by acting in ways that recognize and build on family strengths and capacities. And I think here the infant mental health competencies really fit in nicely, because practitioners are really helping to understand some of those barriers that might interfere with the caregiver's ability to nurture some of those relationships or to be responsive to their child, such as stress, attachment, trauma, and we'll get into that a little bit later too. The next one is interaction 1. So practitioners promote the child's social emotional development by observing, interpreting, and responding contingently to the range of the child's social emotional expressions. And in this instance, the infant mental health competencies, they also align by really supporting the family's response and really wondering with the family too, really wondering and reflecting on the child's feelings and holding those in mind, but also holding the families in mind as well. So I am curious, let's get us started in chat. And I just want you guys to tell me, like, how are you supporting infant mental health in your state? What does that look like?
For those of you that have the capacity to bring this practice, and if not, it's okay. We will get into infant mental health with the rest of the slides. But for right now, if you do work in infant mental health, how are you bringing this into your practice in your communities?
And Elia, if you don't mind just watching that Huba chat too, because I can't see that and I can watch the Zoom.
Yes. Ongoing from Stacy, ongoing education to our agency staff. I totally agree. Thank you for bringing that up, Stacy.
Stacy, that is one of the things that Elvia is the most passionate about, making sure that we are really training the field and we're providing those professional development opportunities. So kudos to you. Yep, yes. I see Bridget by using caregiver coaching practices that focus on social emotional development and by using social emotional strategies. Yeah, so you're really coaching that parent, and you're really, and part of coaching is reflecting, right? So we're reflecting with the parent too. Stacy said, yay, me too, Elvia.
Yes, and then we also have Lori coaching during team time, ongoing local professional development, state trainings, and infant mental health endorsement. Awesome. And promoting
I love it.
Endorsement.
Yeah, Stacy says making sure that parents understand that babies are receptive and can sense their moods and may empathize with them. Yeah, so a big part of that is really educating the parents too, right? And reflecting with them. Madison says they have a school psychologist for pre-K to 12th grade. That's great. And it's good to know what your resources are in your area.
And also that licensed professionals are becoming endorsed and also training infant mental health, because it's a new term for most of us in the United States. Infant mental health is about the child's well-being within the environment. So we want to make sure that licensed professionals also have that capacity to recognize the need.
Yeah, so let's go ahead and get started. We're going to actually open up with just a good introductory video. And it's about 5 minutes long. So while you guys are watching this video, and if you've seen this video before, what I want you to really think about are some of the key concepts that you hear and what this means to you. What does this mean to the work that you're doing? And just jot that down, what this means to you and the work that you're doing. And then we'll chat about it after.
What do we want for our children? What's our goal? Our goal is to have productive citizens that are going to be part of thriving communities. So how do we get from here to there?
As we grow up and as we move into becoming functioning members of society, our mental health is an important part of how we perform our responsibilities as adults. Mental health can't be separated out from cognitive development and language development and kind of social competence. And they all have their roots early on in either a very sturdy or a weak foundation.
We certainly know that infants and very young children can exhibit behaviors, emotional behaviors, motor behaviors, which are predictive in certain cases of subsequent mental illness.
What are the early signs of mental health problems?
I think that when people look at children and think about mental health problems, that they have in mind often is the kinds of mental health problems that we see in adults. They're looking to see the equivalent of a depressed adult in a child or the equivalent of a schizophrenic adult in a child. And I think that because of the nature of development, that when children have mental health problems, they just look different.
Some of the early signs of greater risk for mental health problems are usually not called mental health problems by people. They're usually called, things like behavior problems, or a child who has difficulty controlling his emotions. Some of these may be early signs of what might be a mental health problem later, and some of which may be just differences among perfectly healthy children.
So what does good mental health look like in a child?
Good mental health looks like a child who's curious and interested in the world and wants to learn and can sit and reflect at times about what's going on. It's the ability to experience love, affection, emotions, get upset when things are upsetting, and bring yourself back into levelness without needing intense intervention.
How do mental health impairments develop in early childhood?
21st century science at the molecular level is very clear that all aspects of brain function are the result of an interaction between genetics and experience. Mental illness, as most people think about it, has a very heavy genetic component. Mental health, behavior, personality, also has a genetic component, but it's much more malleable in the face of environmental influences.
Genes and experiences, as far as nature is concerned, are just different ways of setting up operating systems, brain systems, neurons.
What happens when a child experiences what we call toxic stress, severe experiences that can be damaging to its developing architecture? Those toxic experiences essentially create this unstable environment, this unstable foundation.
If sound mental health provides a foundation of stability for a child's development, mental health problems can be thought of like a wobbly table. With a child or a table, there may be many reasons for instability. Identifying which factor is causing instability is the first step towards solving the problem. So how do we restore stability to a child's mental health?
We can detect the early signs of instability. Recognizing what these signs are provides the child with the opportunity then to be placed with healthcare professionals who are trained to develop a more balanced set of skills on the emotional control side.
The prescription is to provide support for parents and in that environment in order to reduce conflict, and that in turn will lead to a reduction in dysregulated behavior in the infant and young child.
Most potential mental health problems will not become mental health problems if we respond to them early. Providing the right kinds of supports and intervention early on will reduce the extent to which this will be a potentially more serious problem later.
Okay, I just love that video. I just think it's a really good, just good description, a good overall introduction. I just want you guys to go ahead, type in the chat, like, what was your takeaway from that? What did that mean to you? Go ahead and type that in the chat. And Sarah, I love your comment too, how Sarah mentioned how she talks to parents about taking time for themselves, and she explains the airplane scenario. So for those that don't know what that is, it's like when, you know, the flight attendant tells you what to do with the oxygen mask, and she says to make sure if you have a child next to you, you put the oxygen mask on yourself first before you put it on the child. And that's really because you have to take care of yourself so you can really think through the steps, the necessary steps to best support that child. Thanks for sharing that, Sarah. Oh, Sabrina says she shares this video during her ASQ trainings. Yes, it's a great one, right? I love it. One of the things that really stands out to me the most is that everything that you guys do, it just matters, right? The work that we're doing, it really can make a huge impact on families and really change the trajectory of children's lives. And I think that's just powerful and huge. Stacy says being aware of concerning behaviors might be a sign that there is more involved. Yeah, and support is, yeah. Yes, I can share the video link. I'll actually put it in the chat after because I'm sharing in Zoom, so I can't multitask in the Whova, but I will get that added too. Yeah, Allison says she hadn't really thought about early childhood emotional dysregulation can be an early sign of mental health challenges later on. Yeah, and that support, the supports that we provide can actually promote lifelong mental health. Yeah. And I think, you know, it's just so fascinating too. And I love how they talked and they really addressed the difference between mental illness and mental health, because that is really critical, I think, in our field to kind of disrupt that that judgment or that bias that kind of comes along with the term infant mental health that people might have, because people think mental health and that's automatically what they're thinking of some of those disorders too for these young children. Well, thanks for sharing. So, oops, I'm gonna make you listen to it again. All right, so let's talk about just the definition of infant mental health. So that is the developing capacity from birth to 6 to experience, regulate, and express your emotions, to form those close relationships and explore the environment and learn, all in the context of family, community, cultural expectations of young children. And it's so funny because every time I read that, I'm like, hey, that's the work that we're doing, right? That's early intervention or that's early childhood. And so it's just, I feel like overall, like it's so important to make sure that we're all supporting the infant mental health of every single child that we're working with. And we're just always curious and we're learning more, whether or not we're endorsed or not, because I think having that professional training, having more experiences, that's going to really help us support these child better. Yeah, Sarah says it reminds me and the parents that behavior is a communication, not kids being bad. Yeah, I try to help parents look at what the behavior telling me, not why are they misbehaving. Yeah, and so we're really taking that framework of understanding the meaning behind the behavior, right? So we're really trying to look at it kind of like a detective. Like that's what I always feel like. I feel like I'm like a curious little detective that's just, my eyes are always opening, my ears are always listening, because I really want to find out more and what might really be going on with every child and family that we're supporting too. So we're going to talk about well, we kind of created this like little visual for you guys to really think and kind of like put it in a little bit more of a perspective for you, because what we're doing in the work that we're doing is we are really jointly sharing equal knowledge with the intent to understand. And that's really what we want. And Sarah, you kind of set us up beautifully with that, because we want to be inquisitive. We want to be able to understand the best ways that we can support families, the best ways that we can support children. And the infant mental health lens can really help with that. Is that Kapana? Did you have a question? I see your hands up. Maybe not, maybe that was an accident. So we'll just keep going. If you have a question, feel free to let me know, or you can type it into the chat too. So we want to make sure that we are sharing information, right? The family's sharing information with us. We're sharing information with them. We're helping them to reflect. We are collaborating. We're collaborating with all team members. And that doesn't just mean our own individual team, but it's really also all of the outside agencies, especially when we're working in supporting like foster children, for example. We want to make sure that we're including that whole team, because we really all need to make sure that we're on the same page to best understand how to really uniquely support each child and family. And that's really what it's all about. And I'm going to pass it on to Elvia to talk about this beautiful, fun visual.
Well, Lisa, as I am listening to you and reading the chats, I invite you to come to the hands. And something that has been helping us here at our work in California, in our agency, we work with families with high levels of stress, and something that has been helping our team of professionals is to reinvent the case formulation, not just relying on what the IFSP says or states, but also bringing the skills to collaborate with the parents on getting a more open-ended questions and conversations so we can learn about their feelings and emotions. And the anger, some parents express anger that they may not be able to express at an intake process. So once we infant mental health practitioners come in with a different understanding of our work, it will give us a better flow to build those relationships so we can provide a safe space for the family. We also we would like to just think and explore and reflect on what is it that we're bringing to these homes, what is different, so we can make it a safe space for the caregiver, because she's our main collaborator. She's the one that will help us to make the change within this child's behaviors or disability or unique need. So then also use that case scenario that you're formulating about each family that you provide sessions. It's what are they passionate about? What is it that works for them and what doesn't work for them? And then what can you get into that, like Lisa was saying in the previous slide, how can we observe the dance between the child and the parent, but how can we also join the dance so we can move forward and support their own systems, and what is the expectations that what is it that they're expecting about us, and why I expect about them, but what is my agency expecting of me, so I can bring a supportive space to this family. How do I demonstrate respect and identify the risk factors that this mom or caregiver or grandma or dad is going through, so I can better protect those factors and be successful with my interventions? That's what infant mental health is about. How do we support each individual adult to have better relationships with the babies that are in our caseload? Like bringing coping skills, also just creating our own case and formulating the questions ourselves, because I do believe that it is within each agency that have that responsibility to train and prepare and equip practitioners. It is not just about early interventionists, but what am I adding to it? What's the other component? It's about helping the children just have those attachments. Alicia Lieberman was my mentor for my dissertation on my program and my doctoral program, and she always said that infant mental health, it's about helping parents understand what they went through when they were little with their parents, and how do we protect those relationships that they experience back into their children in order to create healthy attachments.
Thanks, Elvia. So I'm just going to quickly kind of go through this next piece of information so we can get into some of the strategies and the scenario presentation. But I know that a lot of people aren't always familiar with this, but this is for the Alliance for the Advancement of Infant Mental Health. This map shows right here the states that are in green. Those are the states that are aligned with the Alliance and their members. And so there's an endorsement process in all of these states. In the blue states, they're kind of like in that discovery process. That's what they call it. In the gray states, they are not aligned with the Alliance, but that doesn't mean that they don't have their own endorsement process, because a lot of other states, they've just kind of adopted their own in their states, just like in California, where Elvia is at, they have their own program there. So I will also make sure I'll post that link in there, but it's the Alliance, AIMH.org. And so within this Alliance, there are 4 levels, 4 categories for endorsement. There's the Infant Family Associate, the Infant Family Specialist, the Infant Mental Health Specialist, and the Infant Mental Health Mentor. And so the different levels, it just really varies based on your education and your experience and background on where you would be endorsed at. And then for the areas, the theoretical foundations, like that's one of the, so these are all the infant mental health competencies that are associated with the Alliance. Again, There are some states that have their own infant mental health competencies that were in those gray areas that we saw on the map. But some of the examples, so I want to give you a little bit more examples of what these look like and what that means. So the theoretical, foundations, that's really like that working knowledge of things like attachment, relationship-based practice, family systems, pregnancy and early parenthood, separation, loss, and related mental health disorders. So like, for example, sometimes like what I'm looking at, especially for a newborn child, I might be looking to see if the parent is experiencing any kind of grief from that loss of pregnancy too. And so I might be a little bit more tuned into that and what's going on. The next one is law, regulation, and agency policy. So this is really an understanding of the implications of laws and the regulations as they relate to agency policy for young children, for their families, for the programs, and other service providers. Then we have systems expertise, and that's really an understanding of the human service delivery system. So its particular impact on infants, toddlers, and families, and the ability to kind of navigate those systems in order to best assist families in getting them connected to the right community resources as well. And then we have direct service skills, and that's the work. That's being well-versed in observation and listening skills, screening, assessment, making sure that we're always responding with empathy, treatment planning, evidence-based interventions, life skills, advocacy, and safety, and then working with others. So that's that collaboration piece. So the ability to really build and maintain those relationships as kind of the foundation of working with the infant and their families, and mentoring other people as well, and then utilizing some of that conflict resolution. And then we have communicating. So that's active listening, speaking effectively, and writing clearly, which is probably, so you're starting to see this is probably a lot of things that you guys are already doing in this work too. And then critical thinking. So the ability to analyze information, really exercise some of that sound judgment, maintaining perspective, understanding the group process, demonstrating good planning and organization skills. And then finally, reflection. And I feel like reflection is really a huge piece to this, because that's where you're always curious, you're always self-aware. It's really the critical, it's really critical for our ability to kind of process like the emotional content of the work that we may often feel too, and also to be able to understand the power of the parallel process. So kind of like understanding that domino effect of those relationships and how it can kind of transfer over. And then using supervision as really a big component to professional development.
And this is just one visual for all of us to just review that parent-child relationships need to have a nurturing environment, a nurturing connection, not only to the child, but also those who live in the same system, like in the same families. If we talk about stress, we want to make sure, again, as I stated before, go back and formulate your own case scenario for each family that you provide services. Each family in your caseload is unique. Identify the stress that is impacting the family that may not be involved in the IFSP. Maybe it wasn't communicated. If you're servicing early intervention, for example, here in our state in California, another agency does the initial visit. So sometimes when we get those referrals, we don't have that clear picture of the child and the family. So in regards to attachment, once we train our practitioners here in our agency Find Infant program, what we do is early intervention is so critical. However, infant mental health is not a requirement at this time in California, but our agency Find Infant program made it a priority to adopt this practice to embed it in infant mental health and and early intervention to better support the family through the attachment and the stress components, just to understand who are important for this family life, the child, the mom, the dad, what's happening, and what can we help them with coping skills to improve those relationships while we formulate and the entire case. And trauma, like what is it that is affecting babies? We have babies that are drug exposed. We have little ones that were extremely premature, that went through a lot of abuse and neglect at an early age. That is definitely affecting the family and affecting relationships. And like Miss Alicia Lieberman again said, the ghost in the nursery. She states that the ghost in the nursery is for all of us that have unresolved fear that we were not able to communicate when we were younger. And that gets translated to our current parenting ability. So our job as infant mental health practitioners is to help parents reconnect to their children so they can find that reflective piece, like Lisa was saying in one of the competencies. Once we learn the stages of these competencies, we will be able to formulate the case and to understand what we need to do to help that parent find a village. That's what Ms. Lieberman said. We need to find a village in order to support that mom that is going through depression, that mom that is going through domestic violence or to drug exposure, and we didn't know, especially for us that we do not do the initial intakes, but when the cases get referred to us, just to create a sense of community, to develop coping skills for the family.
Yeah, and I think that, like a big part of it, that's why relationships matter so much, because if we can't build a solid foundation and really build that rapport with families, we're missing a lot of information from families and we're not getting that back from them. So it's harder for us to support the whole family then. And we're going to go into a video next. So this is really going to demonstrate from a parent's perspective. I'm going to have Elvia give you a little bit of background, but I did just want to mention, if you guys were in our session last year, this is another snippet from that video, but we're going to look at it from a different lens. And we're really going to focus on thinking about infant mental health and the work that we're doing and how to support this mother. Elvia, I'm going to let you go ahead and give some background.
Yeah, so this is a young mother. So last year, as Lisa mentioned, we used this video. We interviewed her with the lens of identifying factors affecting early intervention and implicit bias because of her child's unique disability. Now we took it as an opportunity to use the same scenario with infant mental health, which was missing for this mom when she asked for help. So let's listen to the video and let's reflect using the chat. And again, I invite you to put your infant mental health hat just for this hour so we can fully dive into these moms and her feelings and emotions.
And the child's feelings, yeah, too. Let's think about that.
Yeah, oh, the child is only, last year was 1.5 years only.
I think my daughter not receiving smiles back. The constant questioning, the ongoing comments, the looks, the stares. I caught myself making a plan. I told myself I'm gonna go to this store, I'm going to go to Walmart, and I'm going to go, and if somebody approaches me, I'm going to say this. It was a learning. It was like a teaching strategy for myself. Every time that I would go, I would have to mentally prepare myself that what I was going to respond to other individuals, what I was going to say if they said this, if they said she was contagious, if they said she has the measles, because measles was the biggest one that I've got. And, I got that day, I came home, I was very sad that individuals think that of her. I think that really impacted me a lot, that there are people out in this world that are going to continue to be like that. And I got to the point that I don't like going outside. I don't even like taking her out in my community. There's always someone. There's always going to be someone. And if you're not strong to respond, it really impacts you. And, you know, since the start of the pandemic, it has been a big challenge, even with pediatricians or other doctors, other specialists. Their advice to me was to cover her. That's the best advice that they could give me, to cover her so other people will not see her. And I always told myself, why do I have to cover her? Why do I have to do this? Why do I have to do that? Why do I have to adapt to this? Why do I have to put her through that? Why can't people change? Why can't people acknowledge? Why can't people be nice? Be mindful? And it's something that really, to this day, you would think, oh, you know, people that I'm around or in the community, I go to the same grocery store. There's only one grocery store here in my town, and you would think they already know her by now. They're not gonna say nothing. That's not the case.
So this is a 23-year-old young mom that is suffering because her baby doesn't look like the other 2-year-olds. Her baby was born with a rare condition. And us as infant mental health practitioners, how can we just even imagine what is this mom going through to support her child's relationships and attachment to the world that they live in? She's clearly a mom that is in need of help and wasn't receiving it at that time. And just put yourself as the person knocking at the door and going to her and look at her quotes. I think my daughter not receiving the smiles back because her daughter looks different. So I think that us in society, we took that from her, from being her own self, from these babies being her own self. Just put yourself and think about what am I bringing to this mom in my first, second session so I can make her a safe space for her and her baby. She may be able to connect with her baby when they're alone by themselves, but what about dad? What about grandparents? What about brothers and sisters? This is a baby that looks like has a chicken pox, and she has very severe spots in her skin. Imagine everyone staring at her, and how are you coming, knocking at that door, and just how are you going to just start this conversation with a young mom like this that was expecting to have a beautiful infant, and look at her now she expressed that she's concerned about what others are going to say about her now that she's ready to go to school. At one point where I just don't want to go outside, and she kept saying that to me and Lisa during the interview. I'm scared, I'm confused, I don't want to go through that constant looks and questioning from society. So how is an infant mental health practitioner able to provide that support so we can let that ghost out of that nursery, out of her home, and to talk to that ghost and say, this is how it is. I know we understand, but what do you need from me as an in-home visitor? What do you need, and what do I have to come explore with mom, make her a part of this transition? These are painful feelings, right? These are painful very painful feeling for a young mom. And would like to ask your thoughts in the chat. What were you feeling and what were you thinking as you were listening to this young mom?
I'd love to hear too, like how you guys would support this mother. Because this is clearly, she's receiving a lot of trauma where she doesn't want to even go out in the community. So how would we support her too? And I think sometimes there are a lot of families that probably feel like this, especially when we're working with children that may have developmental delays or disabilities. A lot of parents don't want to go out in the community because their child has behaviors. I had one family that didn't want to go out in any special equipment because she didn't want anyone to look at her either before.
Validating her feelings of being upset with other people. I will be too if I'm in her shoes. Thank you, Allison. It makes me sad that the doctor expected her to adjust rather than, yes, I agree. Thank you for bringing that up, Chelsea. That's what the doctor said, right, Lisa? She expressed to us crying that the doctor said, well, you need to understand that your child's condition will not go away, probably until she's an adult. And start covering her, put some pants, and this was 111 degrees here in California. Long sleeves. And it was very, very uncomfortable for me to hear that our pediatricians may be also confused and need infant mental health knowledge to run their practice when they're getting little ones with unique conditions. Yes, shame on the doctor, Shelley says, and there is so much stigma about disability. It is here. Yes, and it's just heartbreaking. I agree. Thank you, everyone. I really appreciate your input.
Crystal added that she would actively listen to the mother and support her feeling comfortable outside. Yeah, collaborate and talk with the mother. And guess what? The beautiful thing in early intervention is our sessions can be out in the community, right? And so we can go out with them too and support her there. Oh, we're getting lots of strategies, I think now. Susan says, support mom with encouragement and strategies that will build mom up with mental strength. Oh, I love that. So she can model to her daughter that she is beautiful and carry that confidence. What a wonderful comment, Susan. Thank you. Yeah, yes. Heather said, I was thinking of how strong she was to question the doctor and ask why. Why should she have to change? Yeah, mom might not feel strong right now, but she is a super mom and needs to hear that. I love it. I love it, Heather. Yeah, Chelsea said it could be helpful to prepare her for a way to respond to people's looks, comments. With her son, I prepared myself to explain how his vision was different than others. Yeah, and I bet that was a process too for you, Chelsea, you know, really getting that explanation. And this mother, she also shared, you know, too, like she really had to kind of like work through it and those feelings. And she kind of had to separate those different feelings of anger that she had to in certain moments and really look at it as an opportunity to engage the community and teach them. Yeah, Shelley says help her find support groups. Yeah, Crystal said even coming along with mom and possibly taking the time to educate others. Yeah, Jenny said she talked about creating a script to share with people when they stare. Yeah, maybe spending some time in the community to practice what she wants to say to adults and kids who are looking at her child.
Yes, Crystal, going back to your chat, to your comment, she shared with us that her only comfort is her Facebook support group with moms that are just going through the same feelings because of having infants and toddlers with the same medical condition. Her diagnosis, this is a little girl, and her diagnosis is urticaria pigmentosa. So that gives children lots of spots, like polka dot spots all over their body, and it will not go away. And sometimes when the weather is depending on the weather, the baby will have them very red and rash. She will have to just scratch her skin to blood. It's very sad. It's a very sad condition. And for people not understanding that this mom needs help, needs a supportive environment, a supportive society, has been a big part of her emotional well-being and mental state as a mom. And talking about reflective parenting, right? Maybe that will be our next year's topic, but how can we help parents to think different? Because she even admitted that she got defensive to herself. Confidence building, Stacy, for mom and for mom with the baby, to help them both in the long run, because the infant mental health is about helping the child take care of his or her emotions without further intervention, right? So how can we expect parents, especially young parents, to support that attachment from their babies when they are stressed and they are depressed themselves, right? And just feeling those feelings of hopeless. And because that's a society that is doing this to her, not only one person or two. Everywhere she goes, she shared with us, the waitress, she shared with us that at the doctor's office, everywhere she goes, at a Target, she used to go to shopping a lot, and now she just preferred not to.
Yeah, well, even like, so another part of infant mental health is really thinking about the child. What are the impacts on that child too?
Yes, she had a very strong start, a very rough start. The first year and a half, she was very like low, minimal eye contact, was not enthusiastic, wanted her to be playful, but she wasn't. So when we intervened, we understood that the parent needed that confidence. And now this little girl is just flourishing. She's smart. She's just a very fun child to work with. But the pain now for the family is she needs to go to preschool now. She's 3. So what's next? How is the preschool going to receive her condition? What are the other parents going to say? And now in this pandemic, are they going to keep thinking that she's contagious? What are we going to do? But let me tell you, she scored so high in her IQ and the rest of the assessments at the school districts that nobody gave her credit, because her condition was not part of the criteria for them to receive services. So therefore, mom has to find a school because this little one did not qualify. And she even cried to the school district and said, I'm scared. I need help with professionals supporting her childhood now that she's starting school, because everyone will be asking her and looking at her at a different way than a normal baby girl.
Yeah. So it looks like we have about 10 minutes left. So let's move on and go ahead into the strategies.
So number one, these are the 5 strategies that Lisa and I kept for you as the most essential to support families, to support children, embrace unique disabilities, and to support them embrace unique attachments and positive experiences to help them form healthier relationships later in life. So the first one is alerting parents to the infants and individual accomplishments. So just talking to this mom about, yes, this is how she looks like, but look what she's able to do. Look, she's counting, she talks English and Spanish. She's playful. She does like 8 to 9 word sentences when she was evaluated at 2.5. So just talk to the parents on that manner as an infant mental health specialist and practitioner, or for those of you that are going through the endorsement process, and hope that you think about considering this to have a different way to interact with the parents. as an infant mental health worker. And the second one, helping parents find pleasure in that relationship with the infant. And here we're referring more not only about parents that are experiencing a lot of depression and sadness, but what about those that, despite of the circumstances in their lives, drugs, domestic violence, and once you do your part as helping the adults, refer them out, you concentrate in that relationship despite of the difficulties. And then number three, wondering about the parents' thoughts and feelings related to the present moment, and to care for the infant and changing responsibilities of parenthood. Let's evaluate what support she has. Where's the baby's dad? Where's the baby's grandparents, aunt, cousin? Is there other adults involved? Like the ghost in the nursery says that we need to find that village, right? Because we need to protect the caregiver from those past experiences. So if this mom went through a rough time last year, and when the baby was born because of her condition, what can we do now to identify a village of support and care for her? And also number four, wondering about the infant's experiences. What is it that this little girl is feeling when she's interacting with us professionals, with others in the community? How can we do outings for her to learn to enjoy other children playing in the park? And also number five, attending and responding to parental histories of abandonment, separation, and unresolved loss, as the article states. And Mrs. Lieberman also talks so highly about that intervention of supporting parents' histories, because that's what they're bringing presently. However, with this young mom, maybe what we found, right, Lisa, is that she was embarrassed to talk about her feelings for almost a year. And that was what created her defensiveness, which was in turn affecting the parent-child care, not because of the lack of love, but because of the unknown. And so we supported her through the infant development and emotional health, and also developing relationships, again, reconnecting again with her community and also with her family that was also questioning. And again, modeling emotional language, it is within us to bring that to them. And then using I wonder statements. I wonder how it will look like if you go back to Target and I go with you. Or what it will look like if you take this like a normal conversation and just be kind and avoid feeling that reaction that will in turn affect you and your relationship with your family. And also using healthy boundaries to maintain respectful relationships with the child, but also to adults around the child that may continue to be confused. And just imagine she'll be a teenager that will look very different from the others. And how do we help that piece of the future now when she's only a toddler and going to start preschool pretty soon? And how do we support parents, both parents, if parents are involved, and find that village for them?
You know, I was going to add to like another good I wonder statement, I think, for like her case. It's like, I wonder how your daughter feels like when you grow in the community and she's like seeing all those stairs and all of that, to really raise mom's awareness, because we do want to also support her and supporting her child in those moments too, right? Because she's going to really be that protective barrier for her. Like, imagine if she would have listened to that doctor and like covered her all the time. Like, children had such a hard time even getting adjusted to like masks, right? In the beginning when everyone put it on, but especially her, she lives in nice sunny weather, and then to be completely covered from like head to toe, like that would be really hard for her in a change compared to like the rest of her family there. Okay, so we have about like 2 minutes because I want to leave it open for questions. So we have about 2 minutes. So we were going to talk a little bit about our experiences, but I think we kind of went through that already. So let's go to the next one, because what I do want to make sure that you guys are aware of, we actually are forming, there's an infant mental health community practice that's getting ready to launch. And we would love for you to become members. You actually don't even have to be a member of DEC to join the committee. So any practitioners, anybody in the field can do that. But of course, we encourage you to also make sure you're a member of DEC as well. And so what I'm going to do is I'm going to drop in the Google, in the Whova chat, I'll drop a Google document. So if you guys are interested in joining that, then just go ahead and put your email down, and then I'll email you. It should be launching fairly soon, but I'll email you and let you know as soon as it's up and on the website. But do go ahead and save the date. There's October 29th from 12 to 1:30. That is going to be our first official kickoff meeting where we're going to really all focus on infant mental health. We're really going to connect and network across the country together and really just try to move some of this infant mental health forward within the DEC recommended practices as well. Yep, go ahead.
Yes. It's free, right, Lisa?
Yes, it's free. Yep, sorry. I was just going to check the chat to see. Lexi's asking if there are any handouts. I'll upload the slide deck, Lexi. I didn't even think about that, but I forgot that we did have those strategies on there. So I'll go ahead and do that and get that done. All right, so this is our information. If you guys have questions, we have 2 more minutes left, so feel free to go ahead and type any questions. I'm actually going to stop sharing for a second so I can put some of those links into the chat for you guys. And then if you, I'll also drop those other links too.